Hi everyone, this is Dalene Barton with naturalfertilityinfo.com, and today I wanted to cover some additional questions people have been asking a lot lately about self-fertility massage. So our self-fertility massage DVD that we carry at the naturalfertilityshop.com, a lot of you already do the program or are interested in the program, and we've had a wave of questions come in. So I thought that I would cover those questions and hope to alleviate any confusion. So let's move on to that. What part of my cycle should I do the self-fertility massage in if I am trying to conceive versus if I'm working to heal my body? So if you are on a healing program, you're not ready to try to conceive, but you're ready to heal a fertility issue, or you're working to prepare to try to conceive in a few months, during those months that you're working to heal or prepare for conception, you could do the self-fertility massage every single day. Ideally, you want to get it in at least 3 to 5 times a week. So that would be 3 to 5 times a week, at least once per day. So if you're trying to conceive, you're not going to want to do it after ovulation, because you would not want to do this type of massage where you're going to be working with the uterus and pressing on it. You would not want to risk implantation at all, so you're not going to want to do it after ovulation. Okay, so is it safe to massage an ovarian cyst, especially a large ovarian cyst? And this sort of covers if you have any type of mass or growth inside of your reproductive organs. So ovarian cysts, uterine fibroids, or endometriosis. You're going to want to really start off slowly at first, not pressing very hard doing the massage, getting to know your body. If you have a very large mass in your body, you're not going to want to be pressing very hard on that. You know your pain levels, you know your tolerance, you will be getting to know your body even more through this type of massage. With an ovarian cyst, because it's usually filled with fluid, you would not, the larger the cyst gets, the more likely it is to rupture. So you're not going to be wanting to press really hard on this area of your body. Just do not do the massage so deep that you're hurting yourself. Really, like I said, just listening to your body, knowing your tender areas, and really working those out, working through those. So it's still safe. You're just going to want to be more aware of those parts of your body that you're working towards healing. Taking it a little easier. If you're feeling more sore one day, just really working gently through that. And as you become more skilled and you're used to the techniques, working deeper, getting to know your body more. It hurts to do the heating pad with castor oil packs because of my endometriosis. Is it still beneficial to do them without the heating pad or the hot water bottle? So sometimes what happens when you have endometriosis and you put heat on that area of your body, it creates more inflammation, which triggers more pain. So in those cases, you would want to not make anything very hot in that area of your body. You would just want to warm it up enough that the castor oil is pliable, so that the castor oil pack feels warm to room temperature. You know about body heat. Once you can warm it up enough, your pores will also open to absorb the castor oil. So, you know, just getting it to warm. If you have a lot of pain from endometriosis or ovarian cysts or uterine fibroids, something to consider would be using essential oils as well in combination with these techniques. So the castor oil packs and the self-fertility massage. Adding a few drops of essential oils. We have a great aromatherapy page to help you learn about this at naturalfertilityinfo.com. And some of the good ones are chamomile, marjoram, or cypress. And you would not want to use essential oils if you think you may be pregnant, so you would not want to do this after ovulation if you're trying to conceive. Is it okay to do self-fertility massage if I'm taking fertility medications? Absolutely. This is one natural therapy that you can do with any fertility program. It's very exciting. Now again, you're not going to want to do it after ovulation if you're trying to conceive, but this is something that you can do with any fertility program. You know, let your doctor know that you're doing it, but it's going to be beneficial for any single fertility program out there. Should I do self-fertility massage and castor oil after my transfer for IVF? No, you would never want to do that. You may be pregnant, and hopefully you are after that transfer. Your little embryo's embedding and implanting in your uterus. So you would not want to risk that in any way. And you would not want to do self-fertility massage after the transfer. I know that you guys probably have a lot more questions. If you have not purchased the Self Fertility Massage DVD, definitely check it out at naturalfertilityshop.com or under the Fertility Massage tab at naturalfertilityinfo.com. Please post any questions you have about this type of massage to this video or to our self-fertility massage sneak peek video. I will post links to that. I will post all the links you need to know, kind of covering what I just talked about for quick reference. I hope you have a wonderful day.